Smoking. Guide to quitting smoking when diabetic. When you give up smoking, you may experience one or more recovery symptoms. Some people call these withdrawal symptoms, but they are actually a good sign. They mean your body is getting rid of harmful chemicals. Most symptoms will last only a few days, but some take a few weeks to settle down. Hang in there, they will go away. Some people experience some of the following recovery symptoms. Cravings. These can be really strong and hard to deal with. It helps if you know how to deal with them, so are prepared when they hit. Occasional headaches. Quitting can be stressful, so try and relieve the pressure by doing some deep breathing or exercise. Tingling fingers. Cigarettes reduce blood supply. When the blood supply improves, more oxygen can cause your toes and fingers to tingle. An upset stomach. This can be a problem while your body is getting rid of the nicotine. A varied diet with lots of fruit, vegetables and water, 6 to 8 glasses a day, can help. Restlessness and difficulty concentrating or sleeping. Your body is adjusting to being free of nicotine. These feelings will pass as your system settles down. Deep breathing and relaxation exercises can help. Coughing. Your lungs are cleaning themselves. The little hairs that clean the lungs are working again and getting rid of the unpleasant stuff in your lungs. Feelings of grumpiness and sadness. For some people, quitting can be like losing a friend. It's normal and okay to feel sad. Do things you enjoy, listen to music, read a book, watch a movie, or visit a friend. Wanting to eat more, using food as a substitute. Choose your food carefully and drink lots of water. Lacking energy. Feeling tired, spaced out or lethargic are common reactions. Get lots of rest, exercise and fresh air. Feeling bored. Stay active and make sure you have plenty to do. Once you've quit, the next step is to stay off. The first 3 months or so after quitting are the hardest time. Most people who return to smoking do so then. During those first 3 months, they've broken their physical addiction but not yet lost their psychological dependence on cigarettes. It can sometimes take just one cigarette to make you feel like you are back on the smoking treadmill. So have some ideas up your sleeve to deal with temptation. For example, plan to take a bath, chew sugarless gum, sip some water, find something to do with your hands, or step outside for some fresh air when the urge to smoke hits you. If you know you are going to be around smokers, be prepared. Practice an answer for when you're offered a cigarette. Seek out non-smokers in the group. Don't apologize for not smoking. Be proud. You've achieved a lot. If you don't manage to quit first time, quitting can be hard. You might be going along okay, then suddenly you feel like smoking again. Sometimes, as you gain confidence, you start to think that quitting is easy, so why not smoke again? Remember that every craving only lasts a few minutes. You can deal with it. Delay, breathe deeply, drink water, or do something else. Remind yourself of the early days when you found it really tough. Think of how far you have come. Do you really want to start all over again? List your reasons for quitting on a card and carry it with you. Read the reasons whenever you feel the urge to smoke. If you slip up, remember that one cigarette doesn't mean you have failed. You are not weak and you are not back on cigarettes. If you think of yourself as failing, you can feel weak and ignore all the good work you have done. Touch base with the reasons why you have stopped and the success you have had so far. Work out why you smoked and how you can prevent it next time. Don't use a slip-up as an excuse to go back to smoking. Slip-up tips. Most slips occur in the first 3 days. Be prepared. After a slip-up, you will probably feel really guilty and self-critical. Remember that everyone slips up. It is how you deal with it that counts. Feeling angry, sad or grumpy can make you more liable to slip up. Find ways to deal with these feelings each day that don't include smoking. Alcohol causes 1/4 of all slip-ups. Drink less, drink differently, e.g. with non-smokers, and go home if it gets too hard. In fact, as a person with diabetes, it's best if you manage your drinking carefully.